HBeAg. Hepatitis B antigen. Welcome to this focus session on HBeAg, the hepatitis B antigen. Let's take a look. Hepatitis B antigen, HBeAg. HBeAg is a marker that indicates that the virus is actively replicating in the body, and thus the patient is highly infectious during this stage. He is actively shedding the virus and can transmit it to others. When is hepatitis B antigen produced in the body? HBeAg is produced by the hepatitis B virus during the replication phase, meaning the virus is actively multiplying in the liver and circulating in the blood. What does hepatitis B antigen indicate? Active viral replication. The presence of hepatitis B antigen indicates high levels of hepatitis B virus replication in the body. Infectivity. A positive HBeAg result means the person is infectious and can spread the virus to others. The absence of HBeAg generally indicates a less infectious state. Monitoring treatment. Hepatitis B antigen testing is particularly important in monitoring the effectiveness of treatment against hepatitis B. So to wrap up, hepatitis B antigen is a powerful indicator of high infectivity and viral activity. It's especially useful in monitoring disease progression and evaluating antiviral therapy response. Make sure to check out the next video on anti-HBe for its clinical counterpart.